Thank you. I want to commend my colleague, Senator Stabenow, for the great work that she has done over a long period of time for women and families in her state of Michigan and throughout the country. I remember her telling me that she got involved in politics in order to address a nursing home issue, which disproportionately affects women, just as this budget that passed the House disproportionately affects women and children. So I'm pleased to be able to join you on the floor and my other colleagues, and appreciate Senator Mikulski's leadership in bringing us together today. There's no doubt that all of us in the Senate and everybody who's spoken on the floor today understands that we need to deal with this country's debt and deficits. There's no question about that. But the question is, are we going to do that in a way that's fair to everyone? And unfortunately, the House Republican plan would disproportionately impact women, in particular older women, because make no mistake about it, the Republican budget that passed the House will end Medicare as we know it today. And since women are a majority of all Medicare beneficiaries, any radical change to the Medicare system will disproportionately affect women, and it will, in the long term, hurt so many women in this country. For example, if we take a typical senior on Medicare in my home state of New Hampshire, under the House Republican plan, that senior's out-of-pocket health care costs are going to double to $12,000 a year. As time goes on, those out-of-pocket costs are going to continue to increase. This health care impact on senior women is especially hard because during most women's working years, they earn less than men. Still true today. Women earn less than men, and women often work part-time or leave the workforce while raising families. As a result, they have less retirement savings on average and lower Social Security benefits. So for women who already have earned less, Medicare is a critical source of financial security. It keeps many women out of poverty. The House-passed Republican budget will end that security. And for seniors who rely on prescription drugs, a real improvement that we made when we passed the Affordable Health Plan, because we made great progress towards closing that donut hole and helping seniors with their cost of prescription drugs. But what the House Republican plan will do is dramatically increase those costs. Again, in New Hampshire, we have 15,200 seniors who will pay $8.5 million more a year in just 1 year for their medications. And of course, we all know that women tend to live longer than men. So as a result, women represent 3/4 of our most vulnerable Medicare beneficiaries, those who are living in nursing homes, in assisted living, or in other long-term care facilities. When their savings runs out, which happens often given the cost of long-term care, seniors must turn to Medicaid to pay the bills. However, the House Republican budget would also make radical changes to the Medicaid system. So their proposal not only threatens Medicare, but it threatens long-term care for millions of women who rely on Medicaid. The House Republican proposal eliminates the current Medicare system and puts private insurance companies in charge of the health benefits that seniors receive. The Republican plan does nothing to reduce the cost of health care. It just shifts that cost of health care onto seniors. And what is going to happen when we shift the cost to seniors who can no longer afford to pay for their health care? They're going to go to emergency rooms. And emergency rooms are not only the most expensive care, because we would have eliminated the preventive care that's part of the new Medicare proposal that we passed for health care, but everybody who has health insurance winds up paying for those emergency room costs that seniors won't be able to afford to pay. So it's a double cost shifting, a shifting to seniors for the costs of their health care and a shifting of those health care costs onto everybody who has insurance. The House Republican budget will hurt all seniors, but it will especially hurt women because they're the most vulnerable. I hope that all of our colleagues will join us in voting against the House Republican budget that is on our desks that we expect to take up this week.